Hi, I'm Jonathan Goldin, and I'm a psychotherapist. And people ask, what does a psychotherapist do and what is it? Well, I'm not a psychologist and I'm not a psychiatrist, so I can't prescribe medication. But I do lots of other things that help people heal, help people get through transitions, help people with relationships. And I happen to have a very open, very informal, very no barriers to entry type of practice, which I've been doing for many years. And I appeal often to men, and often men don't find good therapists that they fit with. Of course, I work with women as well, and people of all adult ages. I used to work with children, but now I limit it to people 20 and above. I happen to have an appeal particularly to millennials, and I kind of see it as a transmission of wisdom from a baby boomer down to millennials, and they seem to really, really appreciate that. I use a lot of humor, and I find that this is very fulfilling work, and I find that my clients make very good progress and find that it's a good relationship. I'm very informal. I call myself Johnny. We text each other about appointments, things like that. And so being a psychotherapist has been a good choice for me in terms of finding a career that made sense. And I also would say that I appeal very strongly to people in creative arts, musicians, performers, actors, comedians, and I'd actually like to have more of those. So please, if you are one of those and you're needing psychotherapy for whatever reason, you're in the midst of transition, you're breaking up with a wife or girlfriend or a husband, problems dealing with kids, problems with financial issues, all kinds of stuff, deciding on where you want to live. I'm out there and I'm ready to help and I'm willing to take people on and come see me. Jonathan Goldin, aka Johnny Goldin. Thank you. Paragraph 6 on my policies and procedures says, therapy is a relationship, not a transaction. And I have all my clients read that paragraph out loud. And what that means is we can never be replaced, hopefully, by robots, because a relationship is fundamental to the entire therapeutic process, which is one reason why during the pandemic, I was one of the few therapists who hardly did Zoom. I found that that's not an easy way to establish the kind of close relationship you need in therapy. Now, what else do you need in therapy to make it useful? Well, some of the things that I make sure to do are empathy, validation, self-disclosure, psychoeducation, which means teaching people about the issues they're grappling with, being transparent, which means telling people about the conditions that they're dealing with, giving homework assignments is part of it, being transparent, having very, very few obstacles and barriers to entry, and just going out of your way, being an advocate for your clients. I've had to advocate for clients, for example, even getting medication approved. I cannot do medication. Many people can benefit from medication. And many psychiatrists, nurse practitioners, and doctors seem to be uninformed or seem to be very overly conservative and cautious about certain medications. So I advocate for my clients even about that, many, many other things. I think that the relationship I establish with my clients is very strong, and it serves me, it serves them, and they get better, they get healthier. Mental health worldwide is in crisis. For example, in the United States, they're saying that the generation, the iGen, kids who've lived now through the pandemic have the highest rate of anxiety disorders ever recorded. And that's just the United States. So what are some of the factors? They're obvious, right? The pandemic, obviously. There's an identity crisis as well, in the sense of ethnic identity, racial identity, gender identity. All the identities are in turmoil, they're in crisis, they're in transition. climate crisis. The loneliness crisis is something I want to specifically talk about in a moment. There's a crisis about empathy. There's a crisis in the lack of empathy shown by systems. Going back to the loneliness crisis, in Great Britain, a number of years ago, they actually created what was jokingly called a minister of loneliness. And it was actually, a woman was appointed, and they've continued to use it in the Secretary of Sports and Society or something like that. They recognize that lots and lots and lots of people are living lonely lives, and that it needs to come out of the closet and needs to be addressed, and that the government can do something about it and help make people aware of it. I feel very strongly about that. I recognize that for my clients, I recognize it for myself. And I think that loneliness is something that is one of the last stigmas that people have a hard time talking about. So that's part of just one little slice of why mental health conditions worldwide are in crisis. And of course, at this moment, I'm talking about a wealthy country like the United States. And just double that, triple that, quadruple that for people living in the third world. Let's roll up our sleeves and start doing something about it. The delivery system for mental health care in the United States is an absolute 1,000% travesty. As they say in movies and comedy, don't get me started. If anybody as a provider of mental health or regular health care is not outraged and enraged and feeling rage and feeling like ranting, then they don't know what the hell they're talking about. Because basically the insurance companies are running the show. And the insurance companies not only rip off providers, but of course they rip off customers. And basically people can spend an enormous amount of time trying to figure out their insurance system, and then it will change 6 months if they change their job or whatever. And so the cost to the system of dealing with insurance is outrageous. And we're the only advanced Western country in the world that has this system. So the delivery system related to the insurance system makes mental health care very, very inadequate. The number of people right now who are demanding mental health care is exploded. It's an avalanche. It's a total avalanche. It's going to stay that way for quite a while. The numbers of people who cannot find, for example, psychotherapists like myself, or psychologists, or psychiatrists, is huge. It's absolutely huge. And every time I get a call about it, people are shocked that I call them back. People are shocked when I call a potential client back, because most of the time they don't even get called back. So basically, providers are shortchanged, customers are shortchanged, and the only people doing well out of this are, guess who? The insurance companies. It's an outrage. So the kind of therapy I do is called cognitive behavioral therapy, which is, the basic premise of it is that our cognition, our thinking about things, has the basic motivation for feelings. The basic cause and effect is that if we're thinking incorrectly, if we're making thinking errors, if we're distorted, if we're overthinking and getting very, very anxious, if we're catastrophizing, which is one of the biggest things people do, catastrophizing, it causes depression, it causes anxiety, it causes a lot of things. So in cognitive behavioral therapy, we start by challenging that kind of thinking. Now beyond that, I definitely have a synthesis of the kind of therapy I do, and one of the other aspects is things like mindfulness. We do meditation in almost all sessions, 10-minute meditation through Calm, Daily Calm, for example. But other things, for example, is like the positive psychology movement, which has identified values of character strengths and virtues. And character strengths that are worldwide, through all civilization, through all history. They've identified 24 character strengths. And there's a nice test that I give, And the point of it is when you find out what your central 5 top character strengths are, you can begin to expand them, begin to use them more, and begin to make them implicit in the work you do, or explicit actually, in the work you do. That you can use that as a basis for your career, for relationships, and so forth. Another thing similar to that I do is called the Myers-Briggs Temperament Inventory, MBTI. And that identifies 4 spectrums, and you get a sense of what kind of people you can easily relate to, but also it's also about learning how to get along with people who are very different. And so it's very valuable with parent-child stuff, very valuable with couples, very valuable in work situations, and so forth. Overall, the whole point of what I'm talking about is based around Abraham Maslow, the famous psychologist, who talked about the hierarchy of needs and talked about what it takes to reach one's potential. So I'm trying to help people move up the ladder and try to reach their potential. And there's no quick fix. I'm not one of these new age therapists who's promising some kind of fake or immediate healing, immediate transformation. No, these are long processes, long, hard processes. And part of it is I give homework assignments. You know, I don't scold people for not doing them, but it's a part of the therapy. It's very central to the therapy, to people continuing week to week and having a thread between one week and the other, one week and the next. So overall, we're talking about a synthesis of positive psychology, cognitive behavioral therapy, some mindfulness work, existentialism I throw in there. There's just a lot of things that I bring to the fore and bring it in a way that reaches people on their own level, whatever level they're at. I mean, I have people on the autistic spectrum. I have people of all kinds of backgrounds. And I'm able to reach them in these ways and able to have them see the benefit and have them see some transformation. And it's a good feeling for them and for me as a therapist.